Let's go through this topic. Topic name is mediastinum. Let's see the introduction. The introductory line says, thoracic mediastinum is the space between right and left pleural sacs and limited on each side by mediastinal pleura. It simply means space between the two lungs. Okay, imagine your chest like a box. On both sides there are lungs like two balloons. The space in the middle between these lungs is called mediastinum. So simple. Mediastinum is equal to space between the two lungs. This is what is told in the introduction. Thoracic mediastinum is the space between right and left pleural sacs and limited on each side by mediastinal pleura. Now let's go towards the extent of it. Extent means where is it exactly, okay? It extends vertically from thoracic inlet to diaphragm. It simply means this space goes from the top of chest, that is neck area, to the bottom, that is diaphragm. In an easy way, it goes from top to bottom of your chest. So what is written? It extends vertically from thoracic inlet to diaphragm. Now let's learn about the division of it. How it is divided. Okay. The mediastinum is divided by an imaginary horizontal plane extending from sternal angle to lower border of fourth thoracic vertebra. Okay. So here is the imaginary horizontal plane. You will have to imagine it. Okay. So when doctors imagine a horizontal line in the chest, this line divides mediastinum into two parts, upper part and lower part. Upper part is superior mediastinum, lower part is inferior mediastinum. In an easy way, let's understand this. It makes upper and lower parts. So the division of mediastinum is superior mediastinum and inferior mediastinum. Okay. Now let's see what superior mediastinum and inferior mediastinum is. Okay. Inferior mediastinum, that is lower part of mediastinum. Again this lower part is divided into three parts. That is anterior, it means front part, middle means center part, posterior means back part. Okay. The lower part is divided into these three parts. Don't forget. Okay. Anterior front part is very small. Middle, that is center part, is the biggest. Why it is biggest? Because it contains heart. Then posterior, that is back part, is the longest. Okay. So in a very easy manner we will remember this. Front part is small, middle part is biggest and back sided part is the longest. So the inferior mediastinum is divided into three parts, anterior, middle and posterior. Now let's see the development of it. Development means how it forms. Okay. It develops from primitive ventral and dorsal mesoesophagus. It means it develops from early structures in the baby body called ventral mesoesophagus and dorsal mesoesophagus. It simply means it forms from early tissue around the food pipe. Food pipe means esophagus. Okay. Now let's revise once again. Mediastinum is equal to space between lungs. It extends top to diaphragm. It divided into upper and lower. Lower compartment is again divided into three parts, that is front, middle and back. Okay, then middle is the biggest. Okay, why it is biggest? Because heart is there. We have learned today about the mediastinum. Remember it, revise it, practice it. Thank you.